Okay, I'm going to give it just a couple seconds because I see our participants are trickling in. But good morning, everyone, afternoon, evening, depending on where you're joining us from today. We're going to get started shortly, but on behalf of the Evaluation Capacity Network, my name is Rebecca Gokert, and I have the privilege of leading the network across Canada and our Decolonial Evaluation Learning team, as well as our partner, the Alberta Mentoring Partnership. We really want to welcome you, provide a warm welcome to today's webinar session, Approaches to Evaluation, Lessons, Reflections, Advice, Trauma-Informed Approaches with our facilitators from Three Hive Consulting. I am very excited to be a listener today. So before we get started, though, I'll just have my colleagues move to the next slide. We want to share our notes of gratitude in being able to virtually join together. I am physically located on Treaty 6 territory, but we are tuning in from across Turtle Island and other parts of the world. We have a nice diversity of folks joining us from all kinds of corners of Canada and even beyond. Our team is very grateful that you have shown interest in this very important topic. The Decolonial Evaluation Learning team is located across both Treaty 9 and 6 territories, and we've partnered with the Alberta Mentoring Partnership to host this year's webinar session. So this is the first of a set of 3. We hope to see you in the future sessions. And together, we're also thankful that we're able to come together and learn more about different approaches to evaluation. So I'll hand it over to you, Cheryl.
Perfect. Yes. So just to make sure that technology runs smoothly today, we've disabled your microphones, cameras, and the chat option to each other. We have a support team in the background, so please hold tight if you have any unexpected interruptions, and our team will do our best to promptly address any issues that arise. You can use the Q&A function if you have any questions throughout the webinar, and we'll take note of them for our Q&A session at the end, and I'll facilitate those ones as well. And yeah, pass it.
Thanks, Cheryl. So it's my honor to introduce Three Hive Consulting, an Indigenous-owned Alberta-based consulting firm. Shelby is the CEO of Three Hive Consulting and Eval Academy. She holds degrees in anthropology from the University of Alberta and has been a credentialed evaluator since 2014. Shelby's background in evaluation and research is both extensive and diverse. Her expertise spans primary healthcare, mental health and addictions, health innovation and virtual care, children and youth, housing and homelessness, and services for immigrants and refugees. Inspired by her entrepreneurial roots, Shelby created Three Hive to foster a work environment that encourages learning, growth, and fulfillment. She leads a dedicated team of evaluators who serve Canadian clients in the nonprofit and health sectors and ensures her team receives a living wage, growth opportunities, and meaningful, impactful work. Eyerusalem is a credentialed evaluator. She has led the evaluation of several provincial and federal government-sponsored programs. Eyerusalem has worked on various projects, including evaluating the performance of a hospital and community paramedics program in Alberta and mental health program in Ethiopia. Eyerusalem collaborates with stakeholders to understand their pain points and works hard to generate evidence to address them. She prepares through evaluation reports to promote evidence-informed decision-making. And then finally, Alecia is a credentialed evaluator with a strong background in evaluating nonprofit and healthcare-related programs. She has worked on projects in a variety of program areas, including primary care networks, mental health, senior care, palliative and end-of-life care, mentoring, community building, and then youth programs. Alecia works collaboratively with project teams to develop, implement, and deliver evaluations. She has a knack for thinking projects through in a stepwise manner and developing creative solutions for gathering, analyzing, and reporting data. So I'd like to hand it over to Three Hive.
Thanks so much, Abby, and thank you everyone for joining us today. This is a wonderful opportunity for our team to be able to share some of the work that we do. It's always great to talk with other evaluators and people who are interested in evaluation. On the next slide is just a quick agenda. You've heard about us, so we won't belabor the introductions. Also not going to belabor what trauma-informed evaluation is. We'll touch on it quickly, but what we really want to do is spend time giving you some examples of what that looks like in practice. Next slide. Thanks. So just a little bit more about Three Hive. You heard already, we are Indigenous-owned evaluation consultancy. We like to say that we help organizations that do good to do better, which just means that we really enjoy spending our time with mission-focused organizations and people who are trying to do their part to make the world a little better. And we see our role as offering some support to help them reflect and learn as they go and, bring a bit of a skill set that's not necessarily built into every organization. So Three Hive has been formally incorporated for over 10 years now. As many of you part-time consultants or folks who are dabbling in consulting will know, sometimes that gets started a couple years beforehand as you're testing the waters. And that's what we did. So Academy has grown out of Three Hive Consulting. It's our capacity building platform where we share tips and tricks and experiences for evaluators, both professional evaluators, full-time evaluators, and the eval-curious, or people who are doing side-of-desk evaluation, students who are learning about evaluation, but really taking like a practical approach to that. So this is all informed by our practical experience as evaluators. A little bit more about what trauma-informed evaluation is. Again, not a whole lot about it. So if we want to jump maybe 2 slides ahead, at Three Hive, we have a guiding process that is our evaluation or our trauma-informed evaluation approach, or our trauma-informed approach overall, because for us, this permeates lots of our work. But these are the trauma-informed practices that we kind of keep in mind as we're building our processes, as we're building our projects. So safety is about staff, it's about everybody feeling that they are physically and psychologically safe in their own definitions of that safety. Trustworthiness and transparency is about processes and decisions that are transparent and intentionally designed to build and support trust. Peer support is fundamental to creating safety and hope. Also helps to build trust, builds collaboration. Collaboration is about sharing power. It's about sharing decision-making, empowering people to be able to say what they want to say, make the choices that they want to make, and acknowledging that, cultural, historical, gender issues inform everything, but that they don't have to limit us as well. So we can move forward with hope and optimism. So we integrate these practices throughout our work. So it starts from the very early stages of project design, where we're developing proposals, we're scoping things out and understanding, what is the evaluation project going to be? Carry that forward into how we develop our plans. So we intentionally look for opportunities to acknowledge trauma, to plan for how we're going to consider and approach trauma throughout our work. Shows up in our data collection tools, right? How are we going to phrase things? What materials are we going to have on hand? What concepts are we probing? What concepts are we not probing? When we're collecting data, we're thinking about, particularly in interviews, we're thinking about what is that interaction like? How do we support safety for ourselves and for the folks that we're talking with throughout? Analyzing data, again, we're keeping trauma in mind. We're thinking about all of these influences and how they might have affected the results that we're seeing. When we're creating information products, so, reports, memos, infographics, whatever those happen to be, we're thinking about how we talk about, not specifically about trauma all the time, but how do we talk about the people who are being served, about the initiative that we're examining, and about the things that we have found. So keeping in mind that, we want to protect safety, we want to also support transparency, empowerment, voice, and choice throughout. So really working on that balance. And then caring for ourselves. In the example that I'm going to share, I'm going to kind of conclude with a little reflection about what does it mean to be doing trauma-informed work as an evaluator, as someone who is sort of external to the work, but is also not external and is a person in the world with thoughts and feelings and experiences as well. So we'll move on then to our first example. And I'm just going to stick my notes right up here on the screen so that I'm looking at you instead of at my desk as I am wont to do, and introduce the project. If we want to move on to the next slide, I don't have a bunch of texty slides. I just have sort of what's hopefully a bit of a calming, well, it was supposed to be more of a video, but grass moving, which is soothing to the brain, because this example is maybe one of the sort of one of the cases I've experienced that has the most trauma in it. Trauma is at the forefront of everything within this this entire project. So this was an evaluation project that we were hired to do within the city where we live, so in Edmonton, where we're based. It was a really interesting collaborative of multiple organizations coming together with the idea that they needed to serve a very select group of people who were, you know, our city's most vulnerable people, but they also happened to be the people who are using the most services. So this was a collaboration that explored the usage of health services, of justice interactions, of shelter services, and other supporting services within the city. So it was a collaborative case management table with the idea that they're going to try and do everything that they possibly can to support these individuals. Started with a small group of people and sort of expanded from there as they tested different processes to see what was going to work. How do we help people get to a better place where they are safer, healthier, where, you know, using a harm reduction approach to see, you know, what micro steps can people take towards, you know, more wellness for themselves. And from the system perspective, how do we help people to stay out of these really sort of cost and time, labor intensive kinds of services? So knowing who we were working with, trauma-informed design was important. So we built that throughout our processes. Our focus on in this evaluation was sort of, there's quant and there's qual. The quant side, we had lots of really great, unusually available data. So we had access to health system data for everyone who was participating in this project. We had access to justice data. We had interactions with police services, or we had access to police services data, as well as shelter stay data at the individual level. Super unusual in most projects, but they had built that into the project design. So what we wanted to do was to combine that quant side with the qualitative and really dig into presenting a client journey. So understanding what was it like for the folks who were being served by this program prior to this level of support being offered, and then what happens to them when that support is offered. Ideally, we would have liked to get a little bit to what about when some of those supports are scaled back. Didn't quite get there in this project, but foundational to doing that was interviews. And so what we collaborated to decide was that folks needed time to understand what our role was. So the idea of doing interviews was introduced sort of slowly, and not by us, but by caseworkers. So they would talk to their clients and say, hey, we're doing this work. Are you interested? You don't have to decide right now. We had information letters, we had forms, we had conversations, lots of different options for whatever was going to be most easily accessible, absorbed, considered by the different clients. We knew that when we were going out to do interviews, this was in person. So I should preface this by saying that this was pre-pandemic, when we did everything in person. And so, you know, we didn't consider doing telephone interviews. These clients generally didn't often have phones available either. So we needed to take advantage of in-person opportunities. Their caseworkers were already visiting them regularly where they were in the community. So whether that was in housing, if they had housing, whether that was, you know, at a coffee shop, or the case that I'm going to talk about, you know, we went and found where this person was the next morning and took her for coffee in a park. But we knew that what we needed to build on was the relationship that they had with their caseworkers. They were trusted individuals. They knew their clients, and they advised us on which clients are probably in a good place to be able to speak with us. Not everyone was. And so, maybe that makes for a skewed sample, but when we're doing trauma-informed evaluation, that's kind of what we have to do. We have to respond to the situations that we're working in. It's not a strict clinical trial kind of protocol. We do what works. So I've shared a little bit about this case with Jules at CES in the past. We've got an article posted on Eval Academy. But so what happened with Jules? This is not her real name as well. Just to make you aware of that. Jules was a 22-year-old woman in Edmonton who had been in Edmonton for about 4 years. She'd been with her caseworker for a while, had a really good relationship with her, really trusted her, and together they felt that they were seeing some progress in working towards her goals. Jules shared a lot about her background. So she kind of introduced herself by saying, I'm a hooker, I'm a junkie, and I'm a drunk. And according to her worker, this was often how she introduced herself. She was used to telling her story in lots of different settings. Part of understanding the client journey was to know a little bit about where did people come from. But we were very intentional in not probing too much, in letting people tell the story that they felt like they wanted to tell. So in keeping with that, the concept of empowerment, voice, and choice, let this be a client-led history giving, I suppose. Jules had a lot to share. And I won't go into the details of the traumas that she had experienced, but they were lifelong and they were extensive and significant, I'll say. On the quant side, Jules had over the past 3 years, 81 visits to the emergency department. She'd had 53 emergency medical services transports. She had 9 hospitalizations for a wide variety of things: pancreatitis, pneumonia, epigastric pain, a leg ulcer. Many of her hospital visits were for head trauma, either falling or being a victim of violence. She was often a perpetrator of violence as well. So she'd had 80 police interactions in the 3 years prior to when we were working that were documented, right? There may have been some other more casual encounters that happened as well. So in this interview, we went to meet Jules, and where we found her was outside of the shelter where she'd spent the night. She spent many nights in shelters. She liked to be around people because she felt safer that way. She experienced a lot of seizures, and she was always afraid that, if she had a seizure while she was alone, she would die. So she liked to be around people. Her alcohol use was so extensive that it was near constant. So in most researcher evaluation protocols, we would say, if someone is impaired, we don't talk to them, right? We'll wait until there's a better time to do that. But for Jules, there was no such time. She started drinking when she woke up. So we were aiming for, with most of the clients that we spoke to in this project, we were aiming for a sober window. So many clients would have, a bit of time in the morning or whenever they woke up that, they would be perhaps a little bit more accessible. Jules didn't have that window. So when we picked her up, she was already drinking. And so I was faced with that choice in the moment as an evaluator, as someone who's trained in research ethics, as someone who has worked in very rigid protocols in the past. What do I do here? Do we talk with Jules or do we wait? Do we come back another day? Do we go try and find someone else? So chatted with her caseworker and with Jules, and she wanted to have this conversation. She wanted to share her story. Her caseworker felt that, there's not going to be another time to do this where she's in a different state. In fact, it could be a much worse state. So we took advantage of, Jules being willing, wanting to share her story, and we proceeded with that interview. So we, got her some coffee, went to a park, had the conversation, and it was very much led by Jules, right? We had some topics that we wanted to probe, but we let that be very responsive to the situation. Her caseworker was with her the entire time. So, sometimes Jules would have questions about something that happened and her caseworker could fill it in. But we also made sure the caseworker was there so that if something did go badly, she was there to offer support. The caseworkers could also advise us whether it was time to cut off the interview. So there was one interview with another client where, he was becoming really, really upset thinking about the things that he'd experienced and the services and the support that he was being offered. So we stopped. So that advice, that guidance from the caseworkers was really important. Jules told her story until she started vomiting in the place that we were at, sort of like an indoor shelter within a park. And we decided, this is probably the time where we end the interview. Her caseworker, cleaned everything up without a blink. And Jules also at the end of that expressed that she was thankful that she was able to talk about this, and she had so much gratitude for the people who were supporting her. So I think that I made the right choice in that moment, because it was important for this project that we hear from participants, we hear from clients, that they're able to share their story in their words in the way that they want to. Caseworkers knew a lot about their clients, and they could have probably told us most of these things, but hearing it from the clients themselves was really fundamental to this project, and I think part of how we considered trauma in our approach here. I should say too, nobody talked about trauma-informed evaluation when we were doing this work. It seems like a term that sort of came later, but it was, all the same kinds of principles and practices were in here. And then just to conclude, without, trying to make it sort of about me, but that need for peer support came up. This was, people sharing stories in this project that were really difficult stories to hear. Obviously, much more difficult stories to experience, but I don't think that we do ourselves any service by ignoring the impact that sort of vicarious trauma or other people's experiences and the stories that they share with us have on our own lives. So, I was prepared to hear about various types of trauma, about various situations, but I don't think I was prepared for some of the examples, some of the really specific things that Jules shared that had happened to her. And, it sort of forces you as an evaluator to acknowledge that truth in the world and to want to be really, transparent in your experience of those truths in the world. So I was fortunate I had, a colleague that I could call up and say, oh my gosh, I don't know what to do with this. I don't know what to do with these feelings. I don't know how I proceed. And then how do we do justice to the truth that has been shared? So I think in our reporting, it didn't look like a real traditional evaluation report. It was almost a little bit more sort of editorial magazine style in a way, almost, because it was really important that we shared people's stories sort of start to end with lots of details within. I will leave it at that. If you have questions about this, I probably went on too long, but if they fit into the end of this presentation, fantastic. If not, please feel free to reach out to me. I'm always happy to talk about any of the examples or any of the work that we do or our approach to trauma here at Three Hive. But I will move on now to Alecia. I believe you are next, and we're going to talk about a different case that you've been working on much more recently than mine.
Yes, thank you, Shelby. This case is maybe a little bit more removed. We don't talk so much about the data that we collected, but more about the process. So to give you some background, we were evaluating outcomes of a grant aimed at building capacity to offer more robust services, resources, and supports to individuals who are experiencing gender-based violence. So gender-based violence is any violence basically based on a person's gender. So it can cover intimate partner violence, but other types of violence as well. And so the client we were working with, they were an organization that happened to offer supports and resources to people who had experienced gender-based violence. So some of the grant objectives included building relationships and enhancing capacity across the gender-based violence sector here in Alberta, and improving some of the organization's kind of client-facing services and understanding how those processes were going. So our evaluation looked at implementation. We also looked at successes and challenges of the grant. And through that process, we wanted to capture feedback from clients, staff, and service providers across the sector to help inform service improvements. So within that, it was really important for us to capture the client voice wherever we can. Let's move on to the next slide, please. So with the client, we created an advisory council to help guide our work. The council included service providers from across the sector, so people who have a wide range of experiences delivering services to people facing gender-based violence, as well as a representative from our client's organization. So together, this advisory council provided input and guided the creation of our evaluation questions and methods and indicators. We also later on involved them in sense making. But focusing back on this plan, despite our evaluation plan, being guided by the advisory council, using a really explicit trauma-informed approach to ensure that we are collecting only the most relevant and usable information that specifically advance the goals of the organization, support the grant, support the sector. What we set off to do ended up looking really different than what we ended up doing. And why is that? We leaned on the principles of safety and collaboration and mutuality. So in our original plan, our data collection methods were varied. We had hoped to do a post-service survey with clients. So after people had called into this service and received supports and resources for the violence that they were experiencing, we had hoped that if the staff in the organization decided this person was in a safe enough place, they would email them a survey link. And they could provide information about their experience. And within that, there would also be a link to set up a time to do an interview if they felt like they were in a safe enough space or could find a safe space and would like to share more about their story. We also included, interviews and focus groups with the staff, focus groups with the service providers across the sector, and then lots of administrative data about the services and supports that these people were receiving when they called in. So for this presentation, kind of like Shelby, we're going to focus in on that qualitative data collection, specifically the client interviews and the survey. So while we had our evaluation plan that was created with our advisory council, when it came time to building our data collection tools, we recognized that we needed to pull in some frontline managers from our client's organization. We wanted to make sure that the people who had the experience, being on these calls and providing the supports and resources and seeing really what the client experience looked like, we needed to make sure they were involved in building the tools with us. And that is that principle of collaboration and mutuality, making sure that, variety of perspectives are included. We were hoping that they would just check that our tools were correct, we're using the right language, and we had the correct processes in place to make sure that clients were safe if they chose to help us and provide data for our evaluation. And so this is where we ended up on adaptation number 1. We had tools all ready to go. We had our survey ready. We had our interview guide ready. We had consent forms and information letters and all of the link processes set up in secure ways. And we presented these to the frontline managers and they immediately pushed back. So despite, working with agencies across the gender-based violence sector, working with a representative from our client organization, the frontline managers felt that the protocols we had created that were meant to make sure that clients were, not in crisis and physically, mentally, and emotionally safe enough to participate, the frontline managers didn't think they were good enough. They were concerned that we were still introducing too much risk to clients. And so for context, people experiencing gender-based violence, when they were calling into this line, they were often still in positions of risk. Perhaps they were still living with their abusers, or in situations they hadn't, left the situation yet. So based on the principles of safety and collaboration and mutuality, we leaned into the expertise of the frontline managers and changed our data collection method. So instead, we created a survey that the frontline staff could offer to clients. So we worked with those frontline managers to create clear processes to help guide staff to determine whether it was safe or not to offer our survey questions over the phone. And then we made sure that the consent and information process and awareness process for the clients was really explicit. So we weren't going to assume that if they answered our questions, they were participating, but we were giving them a very specific, pathway to opt out. And because we had people who were giving them the services and resources asking the questions, we needed to have a really clear way to let these people know that it was okay to say no. This was something extra and separate, and their service provision would not be affected. So frontline managers were heavily involved in crafting the survey questions to ensure our language is appropriate and would accurately reflect on the client experience. The survey was much shorter so that it could be administered over the phone in a short period of time. So our online survey with lots of questions, was sort of modified into a phone survey provided by these or completed by these frontline providers, and it was much more brief. Adaptation number 2, we had hoped to gather names and find a way to connect with clients to interview them, to gather that really rich and robust data, because it was so important to our advisory council that the client experience be forefront in our evaluation. However, those frontline managers, they pushed back here as well. And at the end of the day, we couldn't develop a process that everyone was satisfied would ensure that clients were safe when we reached out to interview them. We decided that client situations were too volatile and the risk of inherently placing them in harm's way by calling, even at a mutually agreed upon time, was just too high. So although our evaluation would have been greatly strengthened by this rich data that could be gathered, it would have been strengthened by being able to, center the voices of these people in our reporting, in our sharing. We decided we had to remove this data collection method altogether. So in this situation, the principle of safety was placed over any benefits of data collection. Next slide, please. So in one case, you might argue that the robustness and the depth of our data collection were reduced, and I would agree with you in that situation. The methods we ended up using were much more brief. They didn't collect as rich data, and at the end of the day, we really weren't able to center the client's voice as much as we'd hoped and talked about their experience because we really didn't have that opportunity to connect with them. We probably missed rich contextual data that could have provided deeper insights. But do I regret the choices that were made? Absolutely not. I think if we consider this evaluation, in the context in which it was performed, I think the choices that we made strengthen our work in the long run. So pursuing our original data collection methods may have inadvertently placed those individuals experiencing gender-based violence in harm's way. If their abuser had intercepted our phone calls or seen our surveys, that could have put them in jeopardy. That could have led to more abuse and more violence, and that would be kind of on us. So would that risk have been worth it to potentially gather a bit more information? Not to me. The stakes were too high and safety was at risk. Additionally, I would like to believe, that the decisions we made built trust with the client and with the advisory council. We showed through those principles of collaboration and mutuality that we were here to share the decision-making and the power with our partners, and that we were here to listen to those who had more expertise. So to me as well, this example demonstrates the importance in a trauma-informed approach of including multiple perspectives, kind of checking your work, your methods, and your assumptions about what's safe or appropriate with multiple groups. I also would like to think that perhaps, the relationship between our client and the sector was a little bit tenuous. And so I think by leaning on the side of safety, I think perhaps we helped strengthen the bonds between our client and the rest of the sector, and perhaps built the sector's trust in us as well. So I left some questions up here for you. Feel free to mull them over. What could we have done differently? Was there another way to prioritize safety that still could have enabled us to collect some of that rich data we ended up missing? I'm not sure. I feel like there's always multiple perspectives to a situation. But at the end of the day, we leaned on our trauma-informed approach and those principles to help guide us through that decision-making process. And I thought it was important today to share an example where, we didn't end up collecting the information that we wanted. And I think sometimes that is the outcome when you're explicitly being trauma informed in your evaluation process. So now I will pass it on to Eyerusalem, who will share another way that she collected data using those principles.
Thanks so much, Alecia and Shelby, for walking us through those great examples of trauma-informed practice. So, and your point really highlights something that became a theme for our project. So the current project I'm talking about today, we have gotten permission from the project, I guess, sponsors to share the name. So it's the Safe Supports project funded by the Justice Partnership Innovation Program and led by the Family Policy and Legislation team at the BC Ministry of Attorney General. And it addresses a critical gap in family support for survivors of intimate partner violence. So using a trauma-informed approach, the project provides wraparound assistance by connecting survivors to essential services, offering clear information and helping with paperwork, ensuring safety, dignity, and empowerment through the process of family law, I guess, legal process. So normally when there is intimate partner violence, there is a lot of support when clients are walking through the criminal side of the justice. But for family law, so such as like property division or custody arrangements and other family law matters, there's minimal support. So this project was intentionally addressing those services for intimate partner violence survivors. And the project provided a lot of wraparound services, and it was designed with a very trauma-informed practice, like initially the project design itself. So when the call for evaluation was out, they really emphasized how, like the clients, the project sponsors emphasized how it's important for them to follow that principles of trauma-informed practice. So as the evaluators, we had to follow that. But at Three Hive, we had a lot of previous examples that we worked through. So we worked with the principles that you saw earlier. So from the beginning, we asked ourselves to enhance client safety and reduce actual or perceived threat and maximize privacy. What's the minimum amount of information we actually need to gather in order and honor the survivor's privacy? So we intentionally collected less data, not more, because holding personal identifiable information creates risk. So we tried to eliminate the possibility of information being misused or leaked or requested by external systems. So this mirrors the trauma-informed practice, where the goal is to reduce perceived threat and maximize privacy. So we made that decision not to collect any identifiable information. So no names, no birthdays, nothing that would, or age, that would track back to a specific person in the community. The only people that whoever knew the survivors' identities were the service providers who had already established like supportive relationships with the clients. Secondly, in this project, trust didn't come from us, the evaluators. It came from the service providers who are already working alongside survivors. So instead of the evaluation team approaching survivors, everything flowed through the trusted relationship. So service providers shared the survey and explained the purpose of the interviews and informed survivors about what participation would entail. So this meant that survivors were never contacted by someone they didn't know. They were never surprised by an email or a phone call from a stranger saying that, hey, do you want to participate in a survey or in an evaluation? They had the option to do the survey anonymously without any contact with us, the evaluation team. But if they wanted to participate in the interview, they provided their contact information to us. So it was instead of us contacting them. So with this approach, we wanted to create a sense of predictability, control, and transparency. So in trauma-informed work, predictability isn't just like nice to have, it's really essential for safety and emotional regulation. And lastly, collaboration and mutuality. Shelby and Alecia touched on this greatly. We were really focused on acknowledging the expertise already in the room. So we relied heavily on the frontline staff to understand the clients' situations better and they also know who's in crisis, who's stable, who's overwhelmed, and who would benefit from that reflecting on their experience. So instead of us creating a list of who to invite, we gave service providers the guidelines and we let them take the final call. So this wasn't, for us, it wasn't just practical, it was very important to us that they shared the power with us and they were the final decision makers. So in this, I guess for this project, we grounded in safety, leaned on like trusted relationships and shared decision making with the trusted, I guess, service providers and people who know the survivors the best. And lastly, in conclusion, so as we reflect on these adaptations we had to make for the evaluations discussed today, I see them not as a like setback, some of the changes we had to make, but as demonstration of what trauma-informed evaluation practice truly requires. It requires adaptability. Each decision we made, whether it was redesigning the survey process or removing interviews entirely, it was grounded in the principles that guided this work from the very beginning. Firstly, safety. Everything we changed ultimately came down to protecting the clients who are already navigating like incredibly complex, vulnerable situations. So by stepping back, reassessing our approach and placing client safety above the desire for richer data, we upheld the most essential principle of trauma-informed practice. Second is trustworthiness and transparency. So we were transparent with our partners about the limitations these changes created. And trustworthiness isn't just about delivering, perfect data, but we made decisions on the go, whether to collect data or not, to scale back. But making this decision very transparently. And finally, collaboration and mutuality. So in all of our work, we've collaborated very closely with the case managers, with the service providers, because we know that they are not only our partners, but they are advocates for the survivors as well. So it's true that our final data set may not have been as robust as we originally envisioned, but I firmly believe that the evaluation is stronger because it reflects the realities and the context that we were working on and the voices of those who understand the risk better and our commitment to not causing harm in the pursuit of information. To me, that's the ethical part of trauma-informed evaluation, is valuing safety, trust, and collaboration above all. So yeah, thank you. That's everything from us.
Perfect. Thank you so much to all of you for sharing these insights. And I appreciate like the idea where it's expecting a process to go, and then as you work with the community, you learn alongside them and things may change. I think that's also the realities of it too, where we have a lot of good intentions and sometimes the resources and the availabilities that we have may not be, it's just not a right timing at that point in time. So at this point, we are opening up the floor for any questions. So there is a Q&A function within Zoom that you can share any questions or comments or musings that you might have for our Three Hive Consulting facilitators. And if you're like me, who needs a little bit of time to kind of put together a question, not to worry. You can take the time to do so. I will read them out as well. And one person has said, wow, great presentation and examples. I just wanted to pass along my appreciation and that it's given me a lot to think about and reflect on. I think that's our goal for today as well, is to be able to kind of reflect on those things. Rabia has asked, thank you for the insight. I'm wondering what your resolution process is once or if someone is triggered and things are going quote unquote south.
Yeah, that's a great question and certainly happens at times. So what our general approach to that is try to plan for that from the outset. So know what would we do in that situation? So if it's an in-person thing, are we taking someone somewhere? Are we calling in external resources? Are we calling 911? Are we calling, the example that I shared, the caseworker was there and much better prepared to deal with any kind of crisis than I was. One of the interviews that we went to, we ended up calling 911 instead because the person was in, medical distress and not prepared to do an interview. So we try to plan for those things as much as possible. In a more virtual kind of setting, it's about having a list of resources or referral sites that we can share, or knowing who can we connect you with at the organization that, has generally who has contracted us. Who can we refer you to? Who can we get to give you a call or something? But it's, yeah, as much planning as possible and then some fast thinking on your feet. Because, as much as we try and plan for everything, we still get surprises, right?
Absolutely. I think it's one of those things that there's always going to be something that might catch you off guard, but it's something that will you keep in your back pocket, and then the next time you do like another interview or another project or evaluation, you're like, okay, this happened before, and now I know I'm a little bit more prepared for that. Perfect, thank you. Someone else has, Manisha has asked, please could you share about the mutuality and evaluation point in brief?
In brief, yeah, that's a real quick topic. I would say that, it's fundamental to what we do. I think evaluation is great for organizations to learn, but it's also such a powerful tool for participants, for clients, for people served to be able to share their voice and hopefully experience the benefits of the work that we do. So, there's our plans don't often enable us to sort of share back directly with everyone who has been served by a program or who provides data with us. In some situations, we are able to introduce that option. But I think, if evaluation was solely extractive, if it was a thing that felt like, it was damaging relationships, we wouldn't do it. Alecia, do you have more to add? I just think it's, that is evaluation. If you're not doing that, you're doing bad evaluation.
Yeah, I think, in the example I shared, the mutuality, it was also balancing that benefit and risk and prioritizing benefit as well. So ensuring that if we're asking people to provide information, they get something from it. So in this case, if we had done those interviews, they really would have informed service delivery in this case. The organization wanted to learn from the experiences. Learning and improvement was one of the goals of the evaluation. But I also think that mutuality piece comes with the respect in which you share these individuals' stories and their data. It's always coming from that strength-based approach. It is always, speaking about them in a way that I think they would want to be spoken about, and making sure that you place not just safety for the participant, but respect for them and their experiences at the forefront as well.
Absolutely. So there are a couple of questions as well that I'm kind of going to chunk together based off of the time that we have together as well. So or a couple of people have kind of touched a point on this fact of funding and finances. So this idea of needing to report back to funders or manage expectations of funders about what kind of results they're assuming they'll see, or assumptions about what's being validated, and just how you kind of navigate that relationship or the expectation from a funder or an organization versus the kind of the experiences and the processes and the work that you do with these vulnerable populations. Yes, and compensation and things like that. I'm kind of like piecing together some of the questions since they have similar ideas, but yeah, just any thoughts on those?
Yeah. Well, I'll touch on the incentives, honoraria, gratitude kind of piece first. It's a non-negotiable. I think we've had a recent example where I think our client would, I don't know, there's a little bit of hesitancy to provide compensation. It's, precedent setting for their organization or something like that. But for us, it's, that's just something that we must do. It's generally quite a small piece of a budget, so it's not something that stands out, unless we're doing, 400 interviews or something like that, which we don't do. It's sort of negligible, but incredibly important to do. And if, a funder doesn't want to pay for it, then, we just do that anyway, right? We, as an external private company, we have some latitude with what we do with money, which we acknowledge not everybody gets. We also have some latitude, or we take some latitude sometimes, perhaps we're not given it, but if metrics are inappropriate, I just skip them. And so far, no funders have gotten really upset with us. I would say that I feel over the past few years, I feel a shift in what funders are seeking from evaluation. And maybe it's just the folks that we happen to be working with lately, but it feels like there is much more acknowledgement of the need for flexibility. And that flexibility is about, in some situations, being responsive to the populations that you're working with. Sometimes it's just, pragmatic responsiveness, right? It's not going to work for us to implement this survey in this community, so we're not going to do it, that kind of thing. But I think as evaluators, we need to kind of stand on that ethical background and say that, if this is going to be harmful to people, we're not doing it. And really none of the funders that we have worked with or sort of in between has ever had any objection to that. Alecia, Eyerusalem, I don't know if you have other perspectives to add.
Yeah, I think it's sort of twofold. I think we have this privilege as an evaluation company that is built upon our values, to lean upon our company values, to say these are the principles upon which we work. And one of them is that people, are appropriately compensated, or that we're not going to gather metrics that cause harm. We are going to do a risk-benefit analysis. I also think that's the benefit of us all being credentialed evaluators. We have that credentialing to lean on, which has a really strong ethics component for us as well. And I would say the other component of that is that we tend to build our evaluation plans collaboratively. So we very rarely come in and just tell people what we're going to do. We work with them and bring them along with us in the process. So they aren't blindsided when we aren't able to capture a piece of information, or we make a decision around, this isn't something that we're able to collect. It's kind of come to mutually. That table doesn't always involve our funders, but it does mean for a lot of the times when a funder does have a question, ourselves and our clients have a really strong kind of foundation to stand on to say why we did or didn't collect something. And oftentimes like evidence of how we've attempted to do it, but have placed certain principles ahead of extractive or harmful data collection.
Yeah, I'll just add to that by saying that some organizations, they cannot give any honorarium, like as a policy or as their regulations. So we have, like, as evaluator, you have to find like a creative way of like processing that. For us, it's an independent, Three Hive is an independent company, so we can like navigate that more easily. So I'll say that for some funders. And secondly, in terms of collaboration, as a role as evaluators is also capacity building. So some people might not have like the experience in the training that we do. So gently guiding and using our expertise to based on evidence and whatnot, whatever resonates with the individual towards best practice, right? That's what they come to us for our work. So just like being comfortable enough in your role as an evaluator to say like this is best practice and this is how we're going to do it, and guiding the funder or whoever is in charge to kind of ultimately buy in.
Yeah. And I'll just put a plug in for Eval Academy. Dr. Bonnie Lacusa did write an article for us about incentives for participation, which kind of explains our approach and the fact that we think that cash is king.
It's definitely one of those like conversations that I've had just in general within like throughout different processes is like how do you properly compensate and also properly meet kind of those expectations from a funder or from an organization, and how do you kind of do that accordingly? We do have a lot of questions left, and I will probably just pick one based off of the time. But I believe, and we will share a lot of resources, including the Eval Academy, which I think has us a couple of resources that have that may answer some of these questions. One of the pieces that I'll kind of piece together is this idea of how do you keep like whether you consult with literature on trauma or things that you listen to, and how do you kind of keep yourself mentally fit as you continue working with specifically with trauma-informed practices and approaches, because it is quite emotionally demanding when we and with all the care and empathy. So I thought that was a piecing together a kind of interesting question there for you all.
I would say we tend to be more led by our clients' knowledge of what is appropriate, by their really deep knowledge of the work that they're doing and who they are serving, than we are by literature. For better or for worse, I find that, the lived experiences of the people that we're talking with are a really strong guide for us. I don't know that we get into the literature that often. Sometimes definitely we'll poke around and have a dabble, I suppose, but I wouldn't say that it's something that we do with a very structured kind of approach, I don't think. I think most of us are sort of aware of intentionally aware of what's going on in the sectors that we work in, and the people that we serve, and evolving practices and that kind of stuff, sort of just by nature of doing the work that we do, and by I don't know what your social media feed looks like, right? So I would say, yeah, Alecia, you might have something that's a little more rigorous.
I think it just depends. In my example, I was talking to service providers, we were talking to people in sector. They were the ones with the lived experience on the ground of interacting with these people. So we let, with individuals who are experiencing gender-based violence, so we let them guide us. At the same time, when I was going to develop, on a different project with a very similar population focus groups, I said, you know what, I bet you there's a lot of literature on this. And so I did. I did a deep dive into the literature around how do we frame appropriate questions for these focus groups with these individuals to make sure that the questions that we aren't asking are triggering or, asking the wrong thing. And in that case, it was helpful. So I think it's sort of a balance. And the literature, when it exists, can be really helpful. But a lot of the time, we're lucky, I think, to be working with people so close, and a lot of the frontline staff that their experiences sometimes are more relevant than the literature.
And what I would add is that in terms of our practice, when we make the evaluation plan, like we tend to do a bit more, I guess, literature review instead of just specifying for one methodology or one data collection piece. We tend to do literature review at the start of when we're developing the evaluation plan in the framework for that sector. That tends to be also some of the practice we do.
Okay, there are a lot of really interesting questions, and I unfortunately we don't have that much time left, but I do encourage you to, reach out to the Three Hive Consulting team, and also check out their Eval Academy. I'll pass it over to Abby.
Yeah, a special thank you again to everyone who's asked questions. You guys have me thinking about things as well. And thanks again to Alecia, Shelby, and Eyerusalem. I'll do this part really, really quick. If you look on the screen, you'll see a QR code for our repository and our stylized guide. I also just added it to the chat, and we'll also be sending these through email later on as well. And then next slide, Cheryl. And then finally, we have our QR code for the AMP resources, and also QR code for Eval Academy, which they've mentioned briefly throughout this session as well, so you can check that out. Yeah. Next slide, Cheryl.
if I can get to the next slides. Okay, there we go. So I love technology and it works. Anyways, we want to thank you for all attending. There's some contact information up here. And we do want to acknowledge that the ECN is a research-funded collaboration that's supported in part by the Social Sciences and Humanities Research Council. We're going to try and take the questions that you have to kind of collate them and hopefully share them through the emails as well. So they're really great questions. So we don't want to necessarily miss out on the questions. But thank you all for joining, and we hope to see you at our other webinar sessions.
Thank you for having me.
Thank you.
Thank you. Cool.